Now try to find out there are the how many chones I told you.
12.
From here to here is 12 chone.
12.
Yes. Now this is the 6th chone. From here to here is 3 chone. Now we recognize this is the 3 chone. Proximal to the ventral wrist crease, midway between the peroneus longus and peroneus brevis tendon. I just apply perpendicularly. I know that where is the 2 tendons. I just touch and palpate it. Now I recognize this is the palmaris longus. This is the flexor carpi radialis tendon. So in between the 2 tendon, I just applied the point. This to be known as a Chianchi. If you measure like this, the point will be here. But if you measure like this, the point will be here. How to recognize this? Because you know this is as a 3 chone, 3 chone, 3 chone. How many chone? 9 chone. But as per the proportional measurement, 12 chone. But how many segments we need to do? 12 segments we need to do here. 12 divisions. In the 12 divisions, this is the 3rd division, isn't it? Likewise, if you select like this, the point will going to misappropriate. So hopefully you can recognize the pericardium, because normally P6 also people apply in this region, but that's not the point ideally. So hopefully we can recognize the pericardium 5. Now this is the Chian. Chian means again it is the shoulder. There is another name to be known as a Chian Shi, that is the intermediate messenger. The name is indicating is the messenger. That messenger, what kind of the message it's giving by using the selective point. Remember, there are the 5 master points are existing in our body. Among them, one point to be known as a pericardium 5 is the Chianchi point. But intermediate messenger, it's indicating that there are the 3 in meridians or meeting point to be known as a Chianchi. What are those? Number 1, in viscera of the hand, that to be known as a 1 is lungs, the second to be known as a pericardium, third to be known as a heart, isn't it? 3 in viscera is communicating point or the junction point, or exactly that point is located on this region. So therefore normally you can recognize the people says, I do have the elbow pain, I do have the shoulder pain, I do have the chest pain, I do have the lungs related disorders or the heart related disorders, brain related condition, my hand is getting numbness, my hand having the cooling sensation, or I do have the numbness and the pain on this region. That indicating, remember, there is a numbness is there, perhaps many reasons to cause the numbness, where the low energy is there, the chi and then blood deficiency conditions. Further, there is a problem normally, there is a inside of this point. So which nerve is located? The nerve to be known as a median nerve. That median nerve, there is a radial nerve, medial nerve, ulnar nerve, musculocutaneous nerve, phrenic nerve. These are the 5 nerves are normally descending from the neck region to the shoulder, from the shoulder to elbow, from the wrist and then tip of the fingers. Normally these are the nerves. But however, these are the major nerve to be known as a median, M-E-D-I-A-N. Median nerve is passing inside, but inside of this point, having the median nerve. When you do it very strongly, you can activate this point. Maybe if your patient gets the sensation, impulses she will get. So if you get the sensation, you just tell me, you got the sensation from where to where?
Not get sensation. Once it pain.
Yeah.
Get sensation.
So if they get the sensation, then it's quite enough. Then we can withdraw the needle. That not necessarily required to keep it for 30 minutes. Remember, whenever we apply the needle, then the patient feel the sensation until just you apply the needle, or maybe you wanted to apply the needle, you just place it for 30 minutes and the patient is not got it any sensation. When you withdraw that needle, that time you just give the sensation and rapidly withdraw the needle and then close the hole. I think that would be really better, so that the patient feel the sensation to open up the orifices, open up the chi level, open up the blood level to regulate the 3 organs. One to be known as a, come on guys, one heart, lungs and then pericardium. three organs or opening point to be known as a pericardium 5. That's the reason P5 is the one of the command point, and no doubt it's the command point and also one of the master point. As per my recognition, the whole body we have the 5 points as the major points or the major junction point. One point to be known as a pericardium pericardium 5. The second point to be known as a Sun Yanglo, that is a Sanjo 8. The third point to be known as a spleen 6, spleen, liver, kidney. The fourth point to be known as a Swan Chung, that is the GB39, where the gallbladder, urinary bladder, stomach meridian meeting point to be known as a GB39. The last point to be known as a 21 point. These are the most of the 5 points are the very very imperative point to treat for the whole body need to be activated by using the 5 points. Remember, all the organs, all the internal energies you can activate by using these 5 points. Perhaps you know the disease or disorder, sometimes you may not know. In that situation you wanted to activate, remember you can activate these 5 points in order to improve the overall energy to be taken place. By the way, hopefully you remember P5 is the good point to treat for the pulmonary system, cardiac system, brain system. So how it will going to work? Remember, this is the grand sun point or the sedative point of the pericardium as well. So therefore this point also belongs to the wood, fire, earth, air point. This is the metal point. So metal is indicating which is governing to the pulmonary system. There is, remember, there is a phlegm. Phlegm is accumulated anywhere on the brain or on the heart or on the muscles or on the lungs, anywhere on the derma, then you can recognize the pericardium 5. The word phlegm is coming. Remember, the word phlegm is coming. Anywhere there is a distension, goiter is there, swelling is there, or perhaps there is a breast swelling is there, or maybe the fibroid, uterine fibroids they do have. Along with that there is a lipoma or anything connected to the lumps, so that to be treatable by using the pericardium 5. Along with that you can add up the one more point, that to be known as a Feng Lung, that is very good, stomach 40. Together you just add up to treat for the 5 different types of the phlegm, invisible phlegm or the visible phlegm. Both the points, of course, is Li14 also really good point. Li14, Sanjo 13 and also pericardium 5 and stomach 40. It's having the amazing results to treat for the phlegm related disorder, where the cough and congestion and sputum and maybe any other related problem. The invisible phlegm also, because brain is having the headache also one reason. When the patient having the emotional setback, emotional problem also related to the, when there is a stagnation of the phlegm in the brain, could be the reason to cause the brain related disorder. So therefore we can recognize the pericardium 5 is a great point to treat for the numerous diseases. Yes.